You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, welcome back to the Active Mom Podcast. I'm your host, Dr. Carrie Pagliano, and I am so excited today. We have on our show MEGHAN RABBITT, and MEGHAN wrote this massive book of knowledge, The New Rules of Women's Health. And how I got to know MEGHAN was a couple years ago. I was working media core with the American Physical Therapy Association. She reached out to have an expert talk about pregnancy, postpartum things. We got to chat, and then recently the book came out, and I got a chance to check it out and reached out to MEGHAN, and she graciously agreed to come on the show. So congratulations and welcome to the podcast.
Thank you so much, Dr. Pagliano. I am psyched to be here. And thank you, honestly, for your time and sharing your expertise, because as I wrote in the acknowledgments of my book, this book would not exist if it weren't for experts like yourself who are passionate about talking to journalists like me, to share your wealth of knowledge. So thank you.
And thanks for asking. I love it when people ask us. We will talk to you for days, as you well know. So.
Yeah. No, it's great.
All right. Well, we start the episode by getting to know a little bit more about you. Tell us a little bit about you. Like, what's your favorite workout when you're not working? What's your favorite thing to do?
Oh, gosh, I love moving my body. So fun fact about me, I was a competitive Irish step dancer all of my young life. Yeah,
Okay.
My mom was born in Ireland. My sister and I started Irish step dancing. And so from a very young age, I just was always moving, and I played a lot of sports when I was a kid. So now the most fun workout I do is pickleball. At some point in this book writing and reporting process, I was like, I need more fun in my life. And I picked up pickleball. I talked my husband into joining me for a learn to play pickleball class. And I got hooked. I'm a former tennis player, and it makes me feel like a kid again. I love it so much. That's one thing I love doing. I love Pilates. I do Legree Pilates. And I really love lifting weights, which is something I changed after doing all the reporting for my book.
I was going to say...
weights. Yes.
We're getting right to what the book inspire you to do. We're going to follow that up with, what is your favorite go-to workout snack?
Ooh, I'm a big fan of a smoothie. I like a small smoothie before I work out. If I do an early morning, like Pilates workout, which I do sometimes like a 6 or a 7 a.m., I sometimes can't stomach like a protein smoothie. And so I'll just do a piece of sourdough with some almond butter and maybe a little drizzle of honey on top. Because I do feel my workouts. That is something else that changed after reporting and writing this book.
Well, I was like, I'm sure that the things that we always have to talk about are lifting heavy, protein, fueling, all these other stuff, sleep. Like we'll get to all that, because that's all anybody talks about anymore. So.
But I love the question. And what's interesting is my sister, she's 2 years younger than me. She's got 2 young girls at home. She's a full, teacher. She is so busy. And she works out every morning. She lifts weights, but she wasn't fueling her workouts. And I had a big conversation with her, and I was like, Maureen, you got to read this part of the chapter. And now she does. And she's feeling better. And honestly, she looks even better. It's like her workouts.
Yeah.
I can see like the difference. It's wild. We have to fuel our workouts.
Yeah, very much, which was not the culture of the 80s and 90s, by the way.
No,
in case you were there, in case you were not.
I was there sweating it out on the elliptical machine, starving.
We were the Snackwells generation. All right, what's something, I don't know if you've had time, but what's something that you're reading, or maybe a podcast that you're listening to right now?
Oh, yeah, totally. So right now I am currently reading Strangers by Belle Burden, the memoir that's going, kind of has gone viral. It's really good. But the last novel that I absolutely couldn't put down is Heart the Lover by Lily King. It was so good. I tore through it. I was on a flight, and I literally could not put it down. It was so good. Podcasts. Gosh, I listen to a lot of different podcasts. The last one I listened to that I thought was really, really great was the Oprah interview with the Coldplay Kiss Cam woman.
Oh,
must listen.
Okay.
I think for all women, because I think she very eloquently dives into woman on woman hatred and why
Oh
we do
dear.
it and what's behind it. And I know it sounds like a big topic, but it is a big topic, but it
Okay.
was a good listen, when as it relates to this video that like, it was billions of us that watched that kiss cam,
Yeah.
moment.
Yeah.
And so anyway, I loved that
Okay.
podcast and I'm telling all my female friends to listen to it.
Okay. I will check that one out. That is not what I saw coming, but I appreciate that. I love that. Speaking of women, who is your woman inspiration right now? Who are people that are totally inspiring you right now?
Mm. I would have to say, because I am just turned 47, I am right in that menopause transition zone. And I am really inspired by all the female physicians who are educating us about
Yeah.
this period of our lives that was just so under the radar and so taboo for so long. And I really credit them with taking to social media and really making it so that I can't go anywhere, whether it's a hike with a girlfriend or coffee with friends or dinner, even with our husbands at the table, without
Yes.
talking about perimenopause. And I am here for it.
Yeah. No, I'm right there with you. I'm about to be 50. I'm trying to think at the time of this airing, whether I will be 50 or not. But either way, it's going to be right around that point. So I'm right with you. I mean, I look at them as like the welcoming committee, and then it's actually been really cool. I mean, I've been a PT for 26 years. I have talked more perimenopause and menopause in the last 18 months than I probably have in the entire 26 years,
I
which
believe
is
it.
so freaking cool. And also because I'm in it, I feel like I'm drinking from the fire hose just like everybody else and get
Yeah.
to have really cool conversations with researchers in this space. So, loving it, loving it for
Yeah.
sure.
Yeah.
All right. What is one thing now that you've kind of come out of your writing shell, um, out promoting the book? What's one thing that's helping you kind of get back to yourself right now?
What a great question. It's funny. My husband would be like, "Yes, what is that, Megan? Because are you, like in a beautiful way, because
You're
I
in
think
recovery.
yeah, I'm still on this like treadmill that I think no matter what any of us are going through, we can relate to that. Like, when is my break? When is my vacation? As my youngest niece, McKenna, said beautifully said to me when she held my book, which is, it's a big book. She looked at me and she goes, Meggie, you want to take a vacation now? She's got this little New York accent. And I was like, McKenna, I need to take a vacation. And I still haven't. So I think really what's helping me get back to myself is at least the acknowledgement that I'm not even close to it yet. And the
Yeah.
inquiry as to what little things can I do every day to try to get me there, to get me a little bit more peace amidst the chaos. So right now it looks like prioritizing my workouts. So I'm going to my Pilates classes I like. I'm scheduling pickleball sessions with my friends. But also just like, can I take a 5-minute walk, in between
Yeah.
meetings or calls, or can I just like, even just push away from my desk and take 3 deep breaths,
Yep.
like when someone says like, when's the last time you took a deep breath? It's like, gosh, doesn't it make you want to take a deep breath right now? Because it's probably a little while ago.
Yeah. I would imagine like interviewing and talking to people that are experts on women throughout the entire lifespan. You probably have all this advice coming in and you're like, oh yeah, I should do that and I should do that. Like it probably, did it feel incredibly overwhelming or did you be like, well, I should be doing this. I should be doing, which is again, we all guilt ourselves and gaslight ourselves and whatnot. Did you feel
Yeah.
that like intensified while you're writing this?
I did. I absolutely did. And I am also firstborn,
Oh,
overachiever, type A. I don't know if you're into like human design. I'm a manifester. If you're into Enneagram, I'm a 3. It's like I am the go getter, get 'em girl. And so I definitely feel like there were times when I was overwhelmed. And there are
yeah.
times even still when I listen to a podcast and I'm like, oh my gosh, I have to overhaul everything. And in those moments, I try to remember what every expert I interviewed for this book also said to me, which is like, consistency is key. Do not let perfection be the enemy of the good. Start where you can. And when I start
Yeah.
to get these like shoulds that overwhelm me, I really just try to take a deep breath and be like, okay, no, this is impossible, to try to
Yep.
reach this like unrealistic standard. What can I do today? Maybe it's just, like I said, like taking a walk after dinner. Maybe it's just making sure I make that protein smoothie after a workout, whatever it is,
Yeah.
like start small and consistency really is king.
Yeah, no, I couldn't agree with you more. Because your book is called The New Rules, like What did you feel like the old rules were, and why did you feel like you needed to write the new ones?
Yeah, I mean, I think there are new rules throughout this whole book in every single chapter, right? And I think, some of the old rules are overarching, like trusting that our healthcare providers like totally have us, that we can just outsource our care and just say, here's what's going on, like what do you think, and not bring any kind of preparation. Like we have to help our healthcare clinicians help us. And I think that's something that's really new. My mom had the same doctor for 30 plus years. I will not have that path. I've had a new primary care physician pretty much every other year because our healthcare system has changed so much, And so I think we really have to take ownership in a new way of our health and our healthcare. I think another big old rule, I mean, outside of like the basics are like not studying women in our own right, using all the male data, and applying that to us, which has left us, with so many unanswered questions, right? But also I think, some of the more subtle things like I learned when I was reporting for this book is like the old way of doing things was to power through your pain if you were a woman. To wear your pain like a badge of honor. Like, things are different since I had a kid, but that's how it's always supposed to be. That's what my mother suffered through, and it's what I'll suffer through as well, right? It's like, no, we need to talk about what's going on with our bodies. We need to name our pain. We need to not think that we're going to be perceived as weak, but rather strong because we're speaking up about what's wrong and demanding the care we deserve, And so, I mean, I think, when it comes to these new rules, they're throughout the book, right? There's new ways of thinking about our anatomy. I loved interviewing the group of largely female anatomists who are saying, no, we shouldn't be calling the fallopian tubes because P.S., the name actually comes from an old Italian priest whose last name was Fallopio. Let's call them uterine tubes. Not only does this help us move forward, but using anatomical terminology that's like in relation to where organs are in the body actually cuts down on cognitive load for our medical school students and healthcare, our future healthcare providers. So it's like, throughout, there's all kinds of new ways of thinking about puberty that I learned. Like puberty is different now than it was when we went through it, right? And so knowing the new research, understanding what clinicians are saying now helps us show up at those appointments with our doctors and our nurse practitioners and all of our clinicians, just feeling more empowered because we're knowledgeable.
Yeah. No, I love that you spoke to puberty. I am in a household right now where 3/4 of my house is going through some sort of hormonal transition. So it's a really fun place right now. And just seeing, like the conversations that I'm having with my kids versus the conversations, I love you, Mom, that I did not have. But I don't know that she was I don't know that she was equipped to be able to have that, or that was expected of her. It was, you go to school, you sit in health class, you have the talk, and that should be it, right? And yes, my kids still have, the talk and, they talk about things in a variety of health classes, but we very much have these open conversations at home. That was not the norm for me. And I have to get out of my shell and also talk to my son about what's going on with his sister because he doesn't know either.
Totally. Oh my gosh. Yes. One of the highest compliments I'm getting about this book with women around my age who've got teenage girls is they're telling me they find their copy of their book in their daughter's bedroom because she's reading it. She's like, wait, what's happening? What, because we still are not giving, they want to know. And we're not giving our young girls an adequate education. It's just not happening in our schools. And so it's on us to educate our young ones and also to give them resources they can trust when it comes to learning about their own bodies, And so I think it's so important. I've talked to my sister about this too. And again, sorry, Mom, but she did her best, right? Our mothers did their best. Yep. They got even worse than they gave us. But now we can do so much better with our young ones.
Yeah, no, for sure. And there's so much of, when you talk to different people about challenges they face and kind of understand their anatomy and what's going on with their body and things like that, if we had given the right information up front as we knew it at the time, it's just a lot less work. And it's a lot less barriers that you have to overcome what those narratives were. So anytime anybody includes puberty, I'm like, we have to talk about the whole span. And I love that you included that because it makes such a difference. It makes such a difference.
It does.
Yeah.
It does.
For you, what do you think the biggest outdated messaging was that you felt like you wanted to address? And because I love a good mythbuster, what were some of these big things that you're like, I really need to get some updated information forward to people?
Yeah, I think it's oh God, there were so many moments where my jaw was dropped. And then I was so surprised at the information I was learning, and then I was surprised that I was surprised because I've been a health journalist for going on 25 years. And so I'm
Right.
like, why don't I know this? One of the big ones is that our gynecologic history actually impacts our future heart health. This is something that blew my mind, and that most women I talk to have no idea. So complications during pregnancy, like preeclampsia, gestational diabetes, even a history of recurrent miscarriages, all of these things we think are in the rear view once we have a baby and the condition clears up, no big deal, right? Maybe. But what we know is that pregnancy is the heart's first stress test. And
Mm,
having complications can mean, that your heart didn't necessarily pass with flying colors. It's
yeah.
not to say that this is a death sentence later on, but
Right.
but it is to say, bring up these issues from your gynecologic history to your primary care physician and then say, look, should I get some
Right.
early heart health screening? What does this mean for my future heart health? And again, it's just one way that I think the old way of doing things is to just be like, I don't have anything to worry about because a doctor isn't telling me anything. And the new
Right.
way is like, no, I need to have this information so that I'm proactively going to my doctors with
Yeah.
this. The other, well, a big one that again, nobody knows this, and I am on a passionate mission to make sure everyone in my world or who's listening to this, like almost like press pause and do this right now. If a doctor hasn't talked to you about your lifetime risk of breast cancer, there
Mm,
are online calculators that you can do to assess your lifetime risk of breast cancer. And anything over 20% is considered high and,
mhm.
and usually qualifies you for additional screening in addition to a mammogram. So mammograms tend to start at age 40, younger if there's a family history or genetic issues, right? Genetic
Mhm.
variants you have. But every woman should be doing this. And our doctors are not proactively coming to us and saying, hey, let's go through and find out your lifetime risk of breast cancer so we can make sure your screening plan
Yeah.
is adequate for you. No doctor had talked to me about this. I did the test myself. I was just under that 20% mark, but
Hmm.
because I also have extremely dense breasts, so it's breast density comes in four
Yep.
categories from like not dense to extremely dense and a high, though not over that 20%, but close to it. I qualified for my first breast MRI. The only reason I had that screening is because I was proactive and brought that up.
Yeah. I think that's one of the things that it kind of circles back to one of the first things that you said is we have this history of expectation that, and it's shifted quite honestly. I think the last several years is that, your physician is in this position of authority. And if they know, they will tell you the things to do, but not realizing that medicine is so siloed. Um, and I think those of us that work in kind of these supportive professions, allied health, if you want to call it, we're lucky because we get to play in all the sandboxes. So sometimes we're the ones that we're almost like coaching people through, hey, you got to check this out for this, or maybe the risk factor for this. But lots of times you won't have that conversation necessarily with your physician. And so you're expecting it, it doesn't happen, you think you're good. But I think the other thing to come along here too is let's talk about the last several years where people kind of fell out of habit with their regular follow-up visits. I know moms after having kids, you're going to do everybody else's appointments except for your own. Then you're missing these marks, you're missing these check-ins, and then lo and behold, your health falls behind. And if you're not paying attention, you're inadvertently potentially at risk for missing something.
I'm so glad you brought that up because that was another big eye opener for me when I interviewed
Yeah.
Dr. Lisa Larkin. She is a women's health specialist. She's also a breast cancer
Yep.
survivor herself. And she is really passionate about talking about how our healthcare system often misses women in this midlife
Yes.
period, which is really unfortunate because in midlife is when we can make all these changes. If you catch high cholesterol, let's say in midlife, you make these changes, you're not having to see the cardiologist later on, or you
Yeah.
do, but for prevention, not treatment, right? diabetes can be caught earlier on, or the signs that disease is developing,
Yeah.
that is when we can be treated and we prevent all kinds of healthcare interventions later on. And so
Mm-hmm.
I think it is so true. My best friend is a mom of two. And, I think she would be fine with me sharing this. She just was so busy momming for so
Yes.
many years.
Yeah.
We were on a hike one day, and I said to her, I was like, I go to the dermatologist every 6 months because I
Mm-hmm.
have very fair skin and I have a history of some atypical moles. And I said, when was the last time you went to the dermatologist? And she's like, 10 years ago. She finally made an appointment. She just had a basal cell carcinoma removed. And now this is a very treatable type of skin cancer. But, had she been going to a dermatologist even once a year, even
Yep.
every other year, even
Yep.
when her kids were little, it would have been caught when it was way smaller, which means
Mhm.
less invasive treatment, right? And so I think it's just a lesson for everyone listening not to beat yourself up for not making the appointment. You have very
Mhm.
real and understandable reasons
Mhm.
for not prioritizing yourself, but
Yeah.
what Dr. Lisa Larkin said to me is like, oftentimes the dog gets more vet appointments than you get
Yes.
doctor's visits
Yep.
when you are in the throes of
Yep.
momming and working and doing, like just keeping your head above water. That has to
Yep.
change. And so maybe just take a minute and be like, what am I behind on? What doctor haven't I
Yeah.
seen? Have I gone to my annual GYN, my annual well woman exam?
Yep.
When was the last time I saw a dermatologist just for a skin check?
Yep.
Just these basic appointments that really just, get it on the books. Even if you
Yeah.
have to wait 6 months, at least it's on the book.
Yep. I have, when we're talking about consistencies here, I typically try and get those appointments in after the kids start school in the fall because my schedule shifts a little bit. Knowing now, although you've got to make these appointments way in advance, like my GP, if I don't make an appointment now, I'm not going to get to see him for like 2 years because he's that guy now. But it's make that on your schedule to be like, I'm going to make these appointments and just get in that habit of doing it. Because I had a friend from PT school who passed away. He had skin cancer on his scalp and Mets and whole thing. And yeah, so
Totally.
it should not take a friend or someone else to have gone through something awful to wake us up to general care and things like that. So yeah,
Yeah.
I'm with you. I'm with
And
you.
ask your girlfriends who to see, who to make the appointment with. Because I think a lot of times we don't make the appointment because we're like, I need a new gynecologist. It's going to be such a hassle. Like, who
Yep.
do I go to? What if I don't like them?
Yep.
Do a little poll of like four of your best girlfriends in your area and say, who do
Yep.
you see? And just get it on the books now for September when the kids are back in school.
Yeah.
And
Yeah.
it's like, that might seem crazy, but usually their books are open then. You
Yep.
have it on the calendar. The kids are going to be in school, so you're going to be in town. And then it's interesting. It's like, how good it feels to like just check things off a to-do list. Like the
I'm that
to-do
girl.
list, I'm that girl too. The to-do list is daunting, but once you start ticking them off, you're like, oh, I
Hmm.
feel good. Making that appointment for like September
Yeah.
or October is just gonna feel good.
Yeah. Well, that's why it really kills me when somebody goes to the effort of making an appointment, putting the time into doing that, and they go and they have like a shitty session or they're not validated. And I feel like there's so many opportunities that people get gaslit when they go to care. And
Yeah.
so I counsel with my clients. I'm like, okay, this is number one, who you're going to go to. I know how you're going to be treated. These are the questions you want answered, but make it easy for them to help you. Go in with a clear understanding of what you want and what you want from them. Don't tell them. Let them do their job and let them kind of, but be clear on that. But it's so hard for me when they go ask and then they get crappy advice like, no, you don't need vaginal estrogen. I'm like, the hell you don't.
Totally.
It's like, come on.
Oh my God,
What is this, crack
absolutely.
cocaine? Like, come on. It's like,
Yeah, I mean, 100%. And I learned a great tip that has actually really changed how I show up at every doctor visit,
mm,
no matter what kind of doctor. When I interviewed a physician who's a general practitioner who said,
mm-hmm.
look, we want more time with you than we
Oh
have.
yeah.
So, because you know that as a patient going in, here's what you can do. You write down your list of symptoms, and even
Yep.
if it's like 20, but then do a key thing. Organize that list in order of priority in terms of how much the symptom impacts your life.
Yep. That's
And then
smart.
when you go to the doctor, you show them the whole list, but it's prioritized list and say, hey, I know we probably only have 20 minutes, maybe 30 minutes. So I get that.
Hmm.
Here's what I'm dealing with. Here's what feels most important to me. What do you think? And she said to me, this builds a bridge immediately between patient and clinician that
Hmm.
says, you get where I'm coming from. But I also want to help you. Let me look at
Right.
this list. Let's prioritize. And then let's talk about follow up care. Maybe we can get through everything else on your list in a telehealth visit, which you won't have to wait so long to do.
Right.
But it's like this one thing that it has shifted how doctors interact with me, to be quite honest with you, because they're like, oh, cool. Okay. Yeah, we can totally tackle this in this visit.
Hmm.
Great. And they almost get excited when they see me being proactive like that, because I think
Hmm.
they're great. Great clinicians love that kind of engagement from their patients, right?
Yeah.
And so I think when it comes to the gaslighting, it's such a pervasive problem. I interviewed an
Hmm.
expert about this specifically, and she said something that really was interesting to me, which is like, oftentimes gaslighting on the part of clinicians isn't intentional. It's
No.
either they don't know how to treat you, and they're freaking out about that inside, but they're just like, not sharing how much they're freaking out about the fact that they can't have it. They don't have an answer for you.
Yeah.
They're stressed. They're overworked. This is not to say it's okay that we feel gaslit, right? But it is to give you some understanding of like, okay, that's the landscape. So then how can I navigate this, knowing what that is?
Yeah.
And if you're not feeling heard or seen, and you're being really open about all of your symptoms, like, it's time for a new clinician. Like,
Yeah.
move on, if you can.
Yeah. No, I think that's great advice. And that's where I also have trouble with, this narrative where it's like anti-establishment medicine. And I think that's where people kind of go off the rails, and they're looking for an answer. So they go off, this holistic or, supplement route or this or that. And that's right. I feel like it's so hard when you have somebody that wants to sit with you and help you work through those problems, and because of the system that that they are working in that doesn't necessarily value them, it's really hard for them to do that job. And so going in an adversarial way, it doesn't help anybody. And so I think when you go in, like, no one goes into healthcare being like, I'm going to help my health system steal your money. Like, no one does that. Like, if you ask every single one of us when we applied to some sort of, health related program for school, the first thing in everybody's essay, I want to help people. That's all we wanted to do.
Totally.
And somewhere
Totally.
we got like driven in these systems and it wasn't a great fit, and we got taken advantage of too. But like, I think, setting up this adversarial system that all physicians are out to get you, I'm
Yeah.
like, trust me, we just want to help people get paid enough we can pay our bills and can sleep at night and go on our merry way.
Totally. I mean, yes. And every single clinician I interviewed for this book said some version of that.
Yeah.
It's like, we want to help you, and we're working within a system that is flawed.
Yeah.
And so it is, again, it comes back to this big new rule, which is like, we as patients need to take ownership in a new way in
Yeah.
terms of understanding the system in which we have to work, and working with it, right? It's going to
Yeah.
get us better care.
Yeah. No, for sure. And I think, going in and, like you said, if you have somebody who's not listening to you or it's not being validated, okay, great. Then this is not a good fit. And I'm going to go find somebody. Like, that person is not wishing you ill will. I promise you. They
No.
probably forgot about you when you went out the door. But there's those of us that will wake up in the middle of the night and be like, and have something that we thought about that we need to talk to a patient about. Know that those of us are out there that we want to help.
Totally.
Um, I know people don't think about us that way, but we do. We wake up at night thinking about patients and whatnot.
I love that. I think it's important to share, because I think you're right. It's when you're a patient navigating the system, it feels one way, but it feels a
Yeah.
totally different way for you as a clinician, right?
Yeah, for sure. For sure. So, as you kind of talk to a bunch of, different experts, you're trying to kind of navigate some of these questions that women have had, through the seasons. What are some things that you ran across that sounded kind of like really convincing, but you found out wasn't necessarily kind of grounded in anything meaningful or research or evidence based or anything like that?
Yeah, what a great question. I mean, I think there's a lot, and I think our social media is not helping this, right? Because we see a lot of trends on social media, and then
Yeah.
it's just so convincing, right? Because
Hmm.
that's what the algorithm loves. It
Yep.
loves a convincing hook, and then we get hooked in, and we're like, the next thing we know, we're like, oh my gosh, I if I'm not doing my cardio with a weighted vest, it's worth nothing, right?
Oh,
So
girl, don't get me started.
there's one example. And again, it's not like, oftentimes I see these trends and I'm just like, huh, maybe, right? But
There's just enough truth in it to get you like, yeah,
yeah, and it's like interesting, right? But it shouldn't, I think the way it's presented often as like having all of this robust data, it's like, one, look at this research that shows women who wear weighted vests lose 50% more weight. And it sounds so good, but you're just like, wow, like how many people were in the study? Was it like three people? So what I think, and it spans everything. Another big one, which I'm sure you hear all the time, hormone therapy. Thankfully, we're all talking about menopause hormone therapy and we're
yeah.
talking to our clinicians about it. But there is a lot out there that just doesn't have the data. For
Hmm.
example, hormone therapy in menopause for the prevention of Alzheimer's and other types of dementia. Maybe, but like there's no medical consensus right now that, the medical consensus is there is not enough evidence. There is not enough data to say that taking menopause hormone therapy will prevent Alzheimer's. Same goes for heart disease. A lot of times we hear like, oh my God, I have to be on estrogen in order to, not have a heart attack later on. The data is not there. Preventive cardiologists will tell you we need more research. Yes, estrogen is important in the heart. There are estrogen receptors all over the heart. So like, maybe taking hormone therapy will help, but if you want the evidence, we don't have enough of it yet. And
Yeah.
so I think it is really important to understand, um, and look for the evidence and look for the medical consensus. And yet again, it is something that we have to do in a new way because we are bombarded with information. We are bombarded with misinformation. And
Yeah.
every single one of your listeners who is a patient and not a clinician needs to understand that we need to become our own health journalists. We need to ask the right questions. We need to actually tuck into the research. And
Yeah.
then we need to know what we don't know and say,
Hmm.
I heard this, and then go to our clinician who we trust and say, what do you think? What does the research show? What is the
Yeah.
medical consensus?
Yeah. I'm having so much more of those like coaching, counseling conversations because people come in and they don't know what to think. And since I've gone through peri now last 2.5 years, like I'm in the same boat. I was laughing when you were talking about estrogen and I can't remember, it was heart stuff or Alzheimer's or something. But I'm thinking specifically last fall there was this like breaking news and there was this study out of the Menopause Society meeting and it says da 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 da. I was literally at that meeting. It was a poster that hadn't even been presented yet. It was retrospective data on medical like medical records. What people were saying it was totally not. And then the poor student that like had done this interview or whatever, then everybody had to walk everything back. And the poor PI was like, oh my God, what is going on? And there was like millions and millions of views. And I was like, this is like the telephone game.
Yes. Yes.
And I think I talk about this stuff a lot because like this is kind of behind the scenes. This is what happened. And you'll see these things come out and be like, it's breaking news. And it was a study from like 4 years ago. And it's not breaking news at all. And if you actually go through methodology, which the average person isn't going to do, and that's okay.
Yeah.
But I literally will sit with people and be like, this is why you think this way, because that's how it was presented to you. Let me pull back the curtain and this is what we actually do know. In your situation, this matters, this does not. This is who you need to talk to about this sooner. It's like you have to get the nuance to some degree, but you also have to see how the sausage is made.
Yes. Oh, totally. And we as patients need to rely on our doctors. Don't
Yeah.
just take social media word you know, uh, for
Yeah.
truth. We have to say, because the other thing too is like what works for me based on my personal and family health history may not work for you. And so it's such an art. And then, we have to know what we don't know. And I think
Hmm.
there has to be a level of skepticism
Yeah.
across the board, really, from
Yep.
all of us with like, okay, you're making a big claim here. As a journalist, when I hear someone make a big claim, I have a skill that's called lateral reading, which everybody can learn right this minute, which is you hear a claim, you open up an internet tab and you Google, weighted vests and weight loss. And then you open up 10 more tabs and you do iterations on that search and you look for the sources that are going to corroborate that information or not. Do
Mhm.
major medical institutions like the Cleveland Clinic, the Mayo Clinic,
Yeah.
support what this claim is? Can you find research that's done in humans? That's going to be harder for the layperson to sort through, but not impossible.
Yeah.
But you have to have this healthy level of skepticism to
Yeah.
understand, is this information that I'm getting that sounds too good to be true actually too good to be true?
Yeah.
Is the person who's telling me that vitamin C is going to make me look like I'm 27, not 47, trying to sell me a vitamin C supplement? These are healthy, skeptical questions that we should all be asking in this day and age.
Yeah, no, that's fair. That's fair. No, and this is where, I try and have, a good sense of humor about all of this, is that I have to believe ultimately that everybody involved is coming from a good place. Some people getting paid more than others, but I digress. Um, some I look at some of these voices as a welcoming committee, but not necessarily who you want to learn the deep stuff from. I look at, all over Arlington, Virginia last year, I literally had a friend, she would text me every morning on the trail how many weighted vests she saw. And so that was kind of like our joke. And I'm like, but it's an opener for me to have a conversation with somebody. And so I'm not going to poo poo somebody for doing things, but if you want to talk about why you're doing it and you're doing it for a reason that actually isn't accurate, let's have that conversation. If you're doing it because it makes you get out and it makes you feel good, great. I'm all on board. Whatever the hell's going to keep you moving, I'm down with that. But it has allowed more conversation. So that's where I'm trying to kind of be open-minded, bright side sort of scenario.
Yeah, I love that. And what I tried to do in my book is, let's take hormone therapy for an example. Like
Yeah.
there's a big explainer about the
Yep.
WHI, what we
Yes.
got wrong, what we need to know now, what,
Yep.
some of the biggest myths about hormone therapy and the
Yep.
truth more doctors want us to know, all steeped in evidence. Because from my perspective, we need to show up to our appointments with some knowledge, right? Because that's
Yeah.
what's going to help us make the most of that appointment. Like if I go to a menopause specialist and say, so doc, tell me about the WHI, it's like we're going to waste so much time with
Yeah.
information that
That's
I
a
could
really
have
good point.
armed myself with, so that
Yep.
instead my first question can be, okay, I'm 47, I'm starting to deal with some hot flashes. Is it time to introduce estrogen? And also,
Mhm.
PS, I don't have a uterus because I had a hysterectomy. Do you think I even need progesterone? Because when I
Right.
have the knowledge, because, of the menopause chapter in my
Yeah.
book, I can say, oh, I know that I don't need progesterone necessarily because I don't
Right.
have a uterus. But if you do
Yeah.
have a uterus, you do need it. And so when we arm ourselves with this information, it not only helps us make the most of these appointments, but I do think with the great clinicians, it makes their eyes light up and they start thinking like, oh, cool, what an engaged
Yeah.
patient. Like, let's have this conversation.
Yeah, absolutely. And that was one of the things, and we chatted a little bit about this before we hit record, was how much fact checking that you did. And I know, at least for my contribution, there was definitely somebody that came back and double checked things. You talked about how much that you did. I know not everyone puts that commitment to a book. I think, again, when you're trying to establish a foundation of accuracy to be able to work from, that's so freaking important. So thank you for that. But I think, again, as a journalist, you're like, well, why wouldn't I do that? Right.
Yeah. Oh, I'm an old school trained journalist, and so everything gets fact checked. And it's cruel and like terrible to give women non-factual information, I think, because it's just we've been yeah, we live in a patriarchy where we've not been given the full information, and for
Yeah.
years we didn't even have the information. So I feel really passionate about at least the information we do have needs to have been vetted by experts, and that's what good journalists do, and that's what I definitely felt passionate about doing in this book.
Yeah. And that's where, again, like when I reached out to you, I'm like, gosh, it took a while for this book, but it takes a while to get things right.
Yeah, it does.
So
It
yeah,
does.
thank you for taking the time
Oh,
to do that. I wanted to make sure that we chatted about that.
thank you for
Um,
recognizing it. Yeah,
yeah.
it was important to me.
Yeah. All right. Let's talk about the stuff that we chatted about. We chatted a lot about pelvic floor things, everything from pregnancy to, post-surgical and all sorts of things like that. You had a little bit of a unique experience after our conversation. Tell us a little bit about that.
Yeah, so after I turned in the manuscript to this book, which was a massive feat, poetically, I had a hysterectomy. And largely because of what I was learning in the years of reporting this book, I realized I had been ignoring my own menstrual health
Mm.
symptoms for years. I had very, very heavy periods. Um, I would joke that it was my monthly hemorrhage, day one, day two. I mean,
Okay.
it was pretty debilitating. I was anemic. I couldn't roll over in bed without feeling dizzy. And I just got used to it. And I was just like, well, I guess this is normal for me. Coming back to, gosh, had I had an education about what's normal blood loss and what's not, I would have thrown up a red flag 10 years before I did about my heavy periods. But instead, I soldiered on. I was, getting my gold stars and my doctor's visits thinking, like, oh, I get my period every 28 days. Look at me, star patient, right?
Right.
Meanwhile, I wasn't saying that I was blowing through a Costco size box of overnight pads every cycle, And so, yeah, so I had a hysterectomy. And honestly, thanks to our interview, pelvic floor PT was like at the top of my list of what I was going to talk about before my surgery, lined up my pelvic floor PT appointments for post-op. And I think it was a real game changer for me.
That's amazing. And and
Yeah.
and we were saying too, like people don't talk about that post-surgical rehabilitation enough, especially with women, regardless of what that pelvic surgery looks like. Because again, we come from a time period where, if you think about, gosh, it was basically, oh, well, you're only going to get a hysterectomy, which when you're done having kids, it has nothing to do with endometriosis or fibroids or any of these other things that now we are finally acknowledging. And then, oh, by the way, you just had major surgery. We should probably do some sort of rehabilitation for that, because it was kind of a big deal.
Yeah. Yeah. And you really blew my mind when you shared with me, and this is not a direct quote, but I'm gonna share what I remember hearing from you, which is that a lot of women, and myself I was included in this group, think the more Kegels, the better. The more we tighten everything. Tighter is better, right? And you were like, oh no, we need to do an assessment because if your pelvic floor muscles are already tight, if they're hypertonic, you could be adding to that and
Yeah.
actually making whatever you're dealing with worse. And that was really in my head as I was like, oh gosh, I think before I talked to you and did that reporting for this book, I might have thought after my hysterectomy, well, just do your Kegels, Meg. Like, let's
Right.
just get it tighter and tighter. And in fact, when I did go to pelvic floor PT, she was like, actually, there's some hypertonic muscles on one side, and another side of my pelvic floor was less, was a little bit weaker.
Yeah.
And it just changed everything, I think, and I
Yeah.
think that's something that's really important for women to know is like, just because you do your Kegels doesn't mean a pelvic floor health assessment isn't needed. And interestingly enough, I'm doing a piece for NPR right now on recurrent urinary tract infections. And I'm
Oh,
interviewing urogynecologists who are saying, oftentimes women with recurrent UTIs are just getting antibiotic after antibiotic, and it's actually not an infection, but pelvic floor dysfunction can be playing into this. That blew my mind. And I think it's something we need to be talking about so that
hmm,
even if we're post pregnancy by many years, or even if you think everything's healthy down there, an assessment of your pelvic floor muscles is really important.
yeah.
It
I will
can be.
tell you one of uh, the biggest honors that I have had in my career is having clients that I had followed through, from their 20s when they were dating to, when they got married, had kids, and perimenopause. And I have a handful right now. And it's so cool to be able to go back to them and say, hey, remember when we didn't know what to do with this and now we do? But also, hey, remember when you were having UTI like symptoms? We figured out it was high tone. It wasn't, we were getting cultures. It wasn't an infection like we thought. You were able to navigate that. You got through pregnancy, and now we're navigating this in postpartum. We're able to pull that thread through, kind of like what you were saying earlier about cardiac issues and things like that. It's so important to understand our pelvic health as young as we possibly can, because I don't know about you, but so much, anytime I hear now, like strong periods, heavy flow. I'm like, even with my friends' kids that are, 14, 15, 16, I'm like, you need to get checked for endo. You need to get checked for these things. So I'm like, if we can get on top of this sooner, is it a possibility? I have no evidence to speak to this from a research perspective. It's just anecdotal. If the brain is now like, hey, this hurts like hell, I'm going to protect, and it reinforces that high tone. Can we shut this down sooner? Can we help the young women of today not have to go through the shit that we had to?
Yes. Oh, I'm
I mean,
totally,
come on, like,
totally. And what's also interesting is that, I interviewed recently a gastroenterologist who's got a very popular book out now, which is fantastic, called You've Been Pooping All Wrong.
ooh,
Dr. Trisha Pasricha. And she said, and she has in her book, pelvic floor health, could be related to constipation. She describes it as the pelvic floor muscles are like a cap on the toothpaste. You got everything moving well, but if that cap doesn't come off, you're not going to be able to get the toothpaste out of the tube. And so that blew my mind as well, where it's just like, gosh, to your point, I think you very eloquently said, gosh, we're just so fragmented in our
yeah,
healthcare system right now, unfortunately. But as patients, if we know that our pelvic floor health muscles could be impacting not just our sexual health, but our urinary tract health, our bladder
mm-hmm.
health, our GI issues,
Yeah,
like we can be proactive and bring it up and say, can you please check this out?
yeah. Well, I think also, again, our health history shouldn't be siloed. If you had leakage jumping on a trampoline when you were 7, and you had bedwetting because you were chronically constipated when you were 12, guess what? That's going to pay it forward. And that's something that we're going to need to consider, and it's going to evolve. And probably when you get to perimenopause and menopause, some of these things are going to change. And is this something that mom and dad gave you with genetics? Is this something that, we can kind of navigate, but it'll be influenced by these hormone changes? Like, it just allows us to continue the story and have the conversation with context. But a lot of us were not taught to look at our health history as a continuum. It's very much these pockets and these silos. And that's why, again, I love the concept of this book, is like, it's all the things. We go all the way
Yeah.
through.
Yeah. And it's all the things. And it's impossible to know all the things. And so a reference book like this is helpful because you can
Yeah.
say, oh, I've got my mammogram coming up, or I have an appointment with a breast specialist because I found a lump and they want to do an
Yeah.
ultrasound and maybe a biopsy. Let me read the breast health section of this book,
Yep.
the breast health chapter. So I just have a baseline knowledge before I go to that appointment.
Mm-hmm.
Oh, my young daughter is about to hit puberty. Like, before I buy her all the puberty books, like, let me get a landscape. Let me get a lay of the land here and
Mm-hmm.
understand the ways puberty have changed. My sister was diagnosed with an autoimmune condition. Wow. Like, why, how does that happen? What puts women at greater risk for that developing than our male counterparts? Let me
Yeah.
read the immune health chapter. And the beauty too is that I had a few people say to me, this book, it's like, it should be a coffee table book, because don't you
Yeah.
want the men in your life and the boys to pick
Yep.
it up and be like, oh, what's happening here? And
Mm-hmm.
like, I have passed chapters to my husband before various doctor's appointments saying, I want you to read this because I need better support from you. And this is going to help
Yes.
you support me. And he's really appreciated it.
Guess where that book's gonna go? It's been sitting in my office. Maybe it's just gonna go home now.
Coffee table.
That sounds awesome. Yeah, my husband, he's also used to like vagina models and like, labia models and things like that on the stair step. So this might actually be a step down from that.
I love it. It's funny. My husband jokes with me that, like, has, at cocktail parties or, wherever we are, people will find out I wrote this book. And then they are like, what is something super surprising you learned? And I often talk about the clitoris because, again, living in my body for 40 some odd years, and I had not seen a picture of the clitoris, and how it's not what most of us think.
No.
It is much more than what you can see from the outside.
Bone.
Yes, and it actually looks like a penis. And this blows people's minds. It is analogous to the penis. And Brian, my husband, jokes that I should like start a Substack that's called Zero to Clitoris.
I like that.
Like,
It's catchy.
I just go, like, let's talk about it. Let's name it. Let's call it a vulva because that's what it is. Let's say clitoris, when we're at a cocktail party. Like, why not?
Yeah. No, that's the thing. I feel like I've been desensitized to all that because I literally have friends that go on the internet in vagina costumes and have literally they'll have clitoris necklaces. I'm not that person. You will not see me in a vagina costume. I have my kids around my necklace, not a clitoris. Like it's all good. Like I have some limits. But no, like I wouldn't it be nice if we could have these conversations earlier and often and have that coffee table book where somebody just grabs it and starts flipping through and learns something that could help somebody someday. And I feel like it's almost now that all our filters are off in our perimenopausal years and we talk about all this stuff on the sidelines of games and activities and things like that, like gosh, why didn't we do this sooner?
Totally.
Yeah,
Totally.
it's why didn't we do this sooner?
Yeah, I mean progress, right? Because we have thankfully made progress. And now and I get excited for younger generations because I think
Yeah,
they're going to take the baton and run even
yeah,
further and faster. I
yeah,
just have this I get hopeful when I see young girls today. You know,
yeah.
they
Oh my
are
gosh, yes.
more in their bodies than we were.
Yep.
They're tuning out advice that doesn't work for them. They're taking on board what does. I get very, very hopeful when I see young girls today,
Yeah.
just being very different in the world than I was,
Yes.
and that's progress
Yes.
too.
Yeah, no, for sure. And again, that's one of the privileges of being, in my field for as long as I have been is that so much has changed. And I was even thinking, my gosh, when we talked, that was a couple years ago, like, gosh, I have learned so much since then. Like at some point, you got to finish the edits, you got to turn it into the publisher, it has to be done. Is there anything that's been swirling around in your head since you had to literally close the book on that you're like, this is what I'm looking towards next, or gosh, the next iteration of this, wow, this would be really cool, and this has changed since then?
Yeah, I mean, what I really tried to do with this book so that it didn't need an update in 6 months after publishing,
Yes,
right?
it should be really hard.
Exactly. Was give like a good solid basics.
Yeah,
Here's what we know, right? But like, yeah, I mean, in an ideal world, this book will get updated in 2 years because we'll have so much more knowledge and
yeah,
information. I'm even thinking
yeah,
about, the story I'm working on right now on recurrent UTIs, and there's been even more research that's come out about that
yeah,
and how vaginal estrogen can help and
yes,
vaginal DHEA and how
yep,
oftentimes it can be UTI symptoms that women just get an antibiotic, but it's actually birth control pills impacting the hormones in the vulva, and so there's always going to be more that I wanted in here. And at a
yeah.
certain point too, it was just like, gosh, this book could be
Well, that right,
70, seven
exactly. Yeah,
hundred thousand pages, not 700, right? And so, yeah, but I think oh, yeah, I think we are making progress. Again, this is what gives
yeah,
me hope as well, right? I think for a
yeah,
long time we were just left out of the studies. We have a long ways to go, right? We still are not funding women's health research to the level it needs to be funded. Women are still not being studied to the extent that we need to be.
yeah,
And we are making tracks in the right direction. And another thing I'm passionate about sharing that has changed since I started working on this book is that I join studies when I can. I look
yeah,
for studies to join because it's one thing to say, and as a women's
yep,
health journalist, I'm often like, it is wrong. We haven't been studied. We've been left out. But like now we can do our part, And so
yeah,
there are studies you can join. It's often not a whole lot of time. Sometimes you get some great perks. Like I joined the wisdom study out of UCSF, I believe. And it's a breast health longitudinal
mm-hmm,
study. Who gets breast cancer? Who doesn't? Like, let's find out
yeah,
why. And so I upload my annual mammograms to that portal that I have. Like,
yeah,
it's a low um, impact. It doesn't take me much time. And I feel like,
yep.
gosh, if this is going to help my nieces, why wouldn't I do it?
I love that. I've been really fortunate working in this podcast to be able to connect and amplify voices for so many researchers. And that's one of the hardest things for them is like we need bodies. We need, in order to publish and to get this information out and to answer these questions, we need people. What's nice is there's so many things now that we can do virtually, so you don't have to be close to a major, medical research facility or things like that. But like, I think that's so important. And again, they're trying to make it low hanging fruit for you to make it super easy. It can be any area from, hormone health to, exercise in across the maternal lifespan. I have friends who do psychology research and will do, group sessions or things like that. Like there's so much out there. And so I try and share as much as I can on social when I've got friends that say, hey, we're looking for stuff. But yeah, we can't have this research without people that want to participate. So that's an excellent point. I'm glad you brought that up.
Yeah. And a bonus is oftentimes you get free care. So
Yes, you do.
I got $1,000 worth of genetic testing for free
Yeah.
as part of that study.
Yep.
I just interviewed a researcher who's doing a study on women in perimenopause and adverse childhood events and how that impacts symptoms. But as part of the study, there's a whole bunch of support that
Yep.
those who have gone through adverse childhood events
Yeah.
get. And this is free.
Yep.
This is free healthcare.
Right.
I even interviewed a doctor for my book who said oftentimes to be eligible for studies, researchers need us so much that they will help us get numbers better, like health markers better for free so that we're eligible to join the trial. Right. And so join what you can. Look in your area, Google your closest medical institution and just ask, like, are you doing any studies for women in perimenopause right now? And just see what comes up. And then odds are you'll find something.
I love that you said that. And especially in this day and age where everybody's doing, quote, their own research. If you have a problem with it, go participate, go join. Again, I have yet to meet a researcher, like a legitimate one that's like, yes, I'm out to trick people. And, like it doesn't work that way. Trust me, they're not getting paid very much. I promise you. And then when they publish, they typically have to pay into the publication company to get it published. Nobody's making money.
Nope.
Oh my gosh.
Yeah.
All right. As we wrap this up, what's maybe one thing that surprised you the most while writing this book, either someone you talked to or something that you learned?
Yeah. You brought up vaginal estrogen before. I immediately, after I learned about vaginal estrogen, talked to my gynecologist about proactively going on vaginal estrogen as a 47-year-old woman. Another thing that surprised me about vaginal estrogen, and I wonder what you would say about this, is that ditch the applicator, put it on your finger, put your finger into your vagina. It's interesting because I tried the applicator and then I tried that and I was like, oh, the latter is so much easier and less messy. I think sometimes the quote unquote mess of vaginal estrogen can make it so that it's a barrier to use. And I'm like, every friend who tells me that now, I'm like, listen to me, put a little squeeze on your finger, put your finger up your vagina, rub it on the anterior wall. Anything that's left, smear it around your vulva and be done with it. It's not messy. It's like going to do all kinds of magical things for you.
Yeah. No, it's so funny. I appreciate that people are talking about it more, but they get this prescription and then this huge, insert that has zero, instructions on what to do. And then you get this one applicator that clearly was invented by a dude. And you're like, wait, when am I supposed to wash this thing? It's got little threads on it. It makes zero sense. But I spend time counseling. I'm like, look, here's the thing. Because understanding there's some people that do not want to stick their finger in their vagina. That's fine. So great. Go to Amazon. We're going to add a little bit to the landfills here, but you can buy extra applicators. Or I think the other thing too, when we talk about where do you want to get that first centimeter or two is where you're going to get the most benefits, urethra, depending on symptoms. I think when people understand the why, then the how, then they're going to be more consistent because they get it, as opposed to somebody hands them in a tube and one applicator and says, good luck. And you're like, I have no freaking idea what I'm doing. So.
Totally. Yeah.
You must have talked to Dr. Rachel Rubin at some point, right?
Yeah, she's amazing. And that podcast she did, was it on Huberman? I feel like it should be like required listening for every woman. She is a wealth of knowledge and on such a great mission to spread the truth.
I have known her since she was a med student at Georgetown. So she would come in and spend time with me when I was a physio there. So I've known her for a very, 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 very long time. She's incredibly passionate then. She's incredibly passionate now. And that's, I think, the coolest thing when you're talking about all this stuff is our algorithms are clearly crossing over, and it's so cool that you're kind of touching on things that I think a lot of us that have been in the space have known for a while, but like it's nice getting it forward to a lot of people so that it's standard knowledge. It's not just this stuff that we're kind of holding to the chest or whatever.
Yeah,
So
totally. And that
I
is the
appreciate
upside of social media, right? At least
Yeah.
we're spreading, you know, some, again, fact check it, right? But there is a lot of really good information that is opening our eyes and to what's been there, and also prompting us to have more conversations so that it feels more mainstream than
Yeah.
fringy.
Yeah, very much so. Very much so. All right. Because I know the book world is a finicky world, where can people find their book? And if we want to get it into more hands, I know it's also about reviews and things like that. So we can help amplify you. I mean, obviously, we've got your Instagram here. Where can people get the book? Where can they leave reviews to kind of help? Because it's all about visibility. The more people that kind of leave reviews and stuff like that, the more people hear about it. What can we do to help?
It's so true. Thank you. Yeah, you can find this book. It was published by Penguin Random House. You can find it anywhere books are sold. So wherever you like buying books. To learn a little bit more about me and this book process, and you can also order the book on my website, which is newrulesofwomenshealth.com. And then, yeah, you're so right. Reviews really are important. And so Amazon reviews, Goodreads, if you learn something, if you like what you see, a 5-star review means the world.
I love that. Yeah. No, again, I'm such a fan of when you see people putting good work out in the world that we need to amplify as much as we can. And again, I so appreciate you reaching out to the American Physical Therapy Association to get a representative. I'm so happy that it was me. I'm so happy we're able to kind of go full circle on this. And thanks so much for putting this. Like we could do some weightlifting with this. No joke.
It's so true.
Do some weightlifting with this.
It's so true. But thank you for your contribution, and thank you for that recognition. Like, I have had a lot of clinicians, doctors, researchers, reach out to me and say, "Wow, you did a good job," and that really. That means the world, because I really was on a mission to bring women evidence-based information that made sense. That was it, written in a way that was engaging, to not be boring. So while this might look like a textbook, I think it's quite readable, and I've gotten that feedback. But that really helps us, because we don't get an education about our bodies that we need and deserve, and we have to educate ourselves.
Absolutely. Absolutely. All right. So this is going on the coffee table at home, the new rules of women's health. It's going to leave my office and go on my coffee table, and we'll see which of my kids picks it up first. Meghan Rabbitt, thanks so much for joining me, and congrats on the book.
Thank you so much. I loved our chat.
Hey guys, hope you enjoyed this episode. If you are a mom thinking about getting back to running, I don't care if you're a couple hours, couple weeks, couple months, couple years postpartum, or even perimenopause like me, and you're not quite sure where to start, check the link in the show notes for my free Return to Run readiness screen. We'll take a look at your balance, we'll check your tolerance to impact, we'll check your hip and your core strength, and at least give you a good idea of where to start, which might actually be a walk-run program and maybe some basic exercises to get going. So check out the link in the show notes, and I hope you're enjoying the show.
If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.